comorbidity, anxiety, vitamin D deficiency, which we are supplementing for, hypertension, GERD, hypothyroidism, insomnia, major depressive disorder. This patient is currently seeing psych. You'll see his whole list of meds there. Coming on down through here, he was treated in 2014 with interferon, but he could not tolerate that. He is not immune to Hep A or Hep B, but he has started the vaccines. As far as his blood work goes, everything was pretty okay. His liver enzymes were elevated. His EPRI score is 1.034. His trial Turco-Q was class A. MELD score was a 7. Like I said, we're supplementing for the vitamin D. His genotype 1A and his viral load was 15,600,000. And so for the additional information on there, I had in there Maverick for 12 weeks. That was incorrect. I think it should have been Maverick for 8 weeks or Epclusa for 12 weeks. Just want to see what you guys recommend for him.
Thank you so much. Does anybody have questions? Please go ahead and unmute if you do.
Robin, how old is he again?
He's 51.
Oh, 51. Okay. Sorry, I missed that first part.
Hey, Robin, any idea why it took him a decade to get back into care after, was the interferon experience that bad that it took a decade to wear off his willingness to seek care again?
So the patient was incarcerated for quite some time. That may have had something to do with that.
Yeah, just curious, since I mean, he really seemed, must have been interested in 2014 to want to go through that garbage. Poor guy, he literally missed the direct-acting antivirals by probably a couple months, since that's when they rolled out. Does he have an F score on a FibroAssure?
He does. F1 to F2.
Do you by chance have any liver imaging on him?
We do not at this time, but I think he is scheduled for an ultrasound.
Okay. My reasoning for that would be just because his APRI is elevated, it's over 1, and he's probably had this for some time. So I just would want to make sure you're getting a visualization of his liver contour too, even though his fibro test looks great. But he has that baseline transaminitis and probably has had this for a while.
Okay. So
Any other comments or questions, Brianna?
Would Epclusa for 12 weeks be good? Would that be good for him?
So that's one of the options for him. So since he's genotype 1A, our options would be Epclusa for 12, Maverick for 8 weeks, Arvoni for 8 to 12 weeks, Zephyr as well for 12, but we're not, we don't really see that one as much anymore covered. Usually it's Maverick and Epclusa that are that most payers will cover. I would say in his case, because of his drug interactions with his famotidine and the omeprazole, I'd actually say probably Maverick's going to be his best choice for 8 weeks. But just remember, it's 3 tablets. He has to take it with food, once daily with food for 8 weeks. But that would be my recommendation for him.
Okay, awesome. Thank you so much.
Sure. Thank you for presenting him.
Thank you very much. I'll go ahead and move to the second case out of the 3. This is a 3740, and it's a 33-year-old white male.
Okay. 33-year-old white male. He is a current everyday smoker, history of IV drug use, meth, heroin, marijuana. He currently resides in a long-term rehab program where he has been sober since November 2023. Comorbidities we have for him: asthma, vitamin D deficiency, some anxiety. The only medications that he's on right now is Vistaril, and we're supplementing for his low vitamin D. This patient was treated in April 2022 with Maverick, an 8-week course, but this patient relapsed and was reinfected. But the treatment was successful for him the first go round. He is immune to Hep A and Hep B. His labs look pretty good, just the ALT slightly elevated. His APRI score is 0.497. Child Turco Q, class A, MELD score is a 6. He is genotype 1A, and his viral load is 10,700,000. So looking at the recommendations, it looked like he could do Maverick for 8 weeks or Epclusa for 12. Which do you all recommend? That was my only questions for you.
Excellent. Thank you so much. Are there any questions considering this case?
This is Kaylee. And how long has he been following with you since he relapsed and was re-exposed?
So he came to us, he was with us in 2022, and that's when he was treated. He came back to us in 2023. So just since the beginning of November,
Okay.
there.
Okay. So I mean, from a treatment standpoint, I think you could do either the Maverick 8 weeks or Epclusa for 12. I don't see any issue with either of those. I would tell you though, since he's a retreatment and a reinfection, I would be a little bit more cautious about treating him again right away, since it's only been a few months. It's also pretty difficult to get insurance to approve a second course of treatment. There is a supplement. He's Medicaid, correct?
Correct.
Okay. There's a supplemental form, a retreatment form that is on the DHHR website. I think at one point we've sent it out with our Echo emails too, and Rachel's awesome, and she has already attached the link. But if we have a patient that's getting retreated, whether it be reinfection or relapsing or treatment failure, an infection or GI doc physician has to sign off on the case. There's also a guide. It's basically saying, you know, what led to them failing treatment the first time and what strategies are going to be different this time. What have you worked out with them, and how closely are you following the patient to ensure that they follow through with care? With my retreatment patients, I typically, especially if it was a reinfection, I typically follow them for about a year regularly, just to make sure that they're going to follow up and care. Now, if they were already cirrhotic or anything like that, I may be a little bit more aggressive with getting them retreated sooner. But typically when I follow up with them while they're on retreatment, I follow with them weekly for the first month. Whether it be through phone check-in or nurse check-in or pharmacy check-in or in-office visit. And then I follow with them twice a month through the remainder of their treatment course, and then monthly through SVR 12, just so that you're really making sure that they're going to follow up consistently. But those are things I would just consider with starting him on treatment. Your treatment options are going to be exactly what you said. Even though he was treated with Maverick, this is a new infection, so he would still be treatment naive.
Okay, great. Thank you so much.
Sure, thank you.
Thank you very much. Any further questions for that one, Bree?
No, I think I'm all good.
All right, we'll go ahead and move on to the next. Give me one moment, please. All right, this is your case 3741, and it's a 34-year-old male.
Okay. 34-year-old white male. He is a current everyday smoker. He started using drugs around the age of 15. He has overdosed twice, but was never hospitalized. Heroin was his drug of choice. History of benzos and marijuana as well. He reports to us that he has been sober since 2022. Prior to 2022, he was incarcerated for quite some time. He currently receives a Sublocade injection. He has a good support system at home with his dad, mom, and brother. As you can see, he's only on the Sublocade and Colace. He claimed that he was treated while in the military back in 2009 with interferon, but he could not tolerate the medication, and he did not. He is immune to Hep A and Hep B. His blood work was pretty good, except there again for the liver enzymes being elevated. His APRI score 1.135. Child Turco-Q class A. His MELD score was a 7. There was a low vitamin D, which we are supplementing for. He was genotype 1A, and his viral load was 11,400,000. I had in here is 8 weeks of course of Mavra appropriate for this patient, or Epclusa for 12. That was about all on him as well. So.
Great, thanks again for another case. Any questions for this one?
Just another question about the FibroSure, because I'm driving, I can't see the form. What's the FibroSure on this guy?
So his was F0 to F1 as well.
So are his transaminases very high or his platelets very low? Out of curiosity, what's making the APRI so high?
ALT 111, AST 64. His platelets are 141.
Okay, just he's had. I know. How old is he? 30 something.
He is 34.
Yeah, but clearly been infected since a while. If he was treated in 2009 in the military, so you've got this disparate results on some of your non-invasive tests of fibrosis, and would be another one like Kaylee mentioned earlier, where imaging would probably be warranted. Ideally an elastography would be a tiebreaker to allow you to triangulate the truth. I'd probably err towards trusting the FibroSure more in this guy's case, but that nearly 1-to-1 ratio of his transaminase elevation and platelet counts is going to at least make his APRI high. So have a little bit of worry that you need to make sure you know the truth about his fibrosis status.
Okay.
And again, big picture comment, Hep C, super curable, liver cancer, that consequence that can come from the scar tissue, Kaylee and I can attest, can haunt people even after their treatment. And so really important to get that documented, whether or not they have a lot of scar tissue. I doubt he does, but again, if you did liver imaging and it demonstrated morphology very consistent with a cirrhotic liver, then that would be worrisome. A lot of times you don't get that, and that's thankful. It's a good thing. That's why we love elastography, because it can demonstrate a lot of scar tissue even before that sort of end stage cirrhotic appearance. So love some extra data points on him.
Okay.
Great, thank you so much, Dr. Gilfus. Any further questions for that, Bree?
No, that's all. Thank you guys so much.
No, thank you so very much. We really appreciate the cases. All right, I'm going to go ahead and hand over the gauntlet to Jennifer Boyd. And we'll just discuss some things she wants to discuss.